Hi, I'm Dr. Leah, and today we're going to be doing radial shockwave therapy or physiotherapy. And so what this does is a more effective way to help heal the soft tissue. And so what it does is it uses sound waves in order to penetrate the tissue deeper, in order to activate at the cellular level more blood flow, growth factors, things of that nature to help reduce inflammation and also to bring healing to the area. And this is very helpful, yes, with acute injury, but also when we have chronic pain issues, such as my patient here with her back and her shoulder and neck, will help with that today. So I did my physical assessment already and checking her back and her neck to see where the problem areas are that I'm going to be treating today. And then we're going to be using this machine today to do that. So I'm going to get that started. Okay. All right. We're going to get going here, okay? All right. Okay. Here we go. So we're going to get up in here to our teres minor and teres major. So you hear that sound? That's our shock waves going into the body. This is used with ultrasound technology. Yeah, right in there. And that sound it makes. You might hear the machine. Start the fan here in a second. But this really gets deeper into that tissue where stretching and normal physical therapy has a harder time getting to in order to have a more quicker effect that goes with that. Yeah. Go a little higher now on this opposite side. There she is. So what happens often with chronic pain, which some of the issues that can be with that, is because our musculature, if it's compensating or injured, it get used to being in a misaligned area, or we have fascial adhesions that doesn't allow for good blood flow to the area. As a result, we'll have pain, either because of low blood flow area or because it's putting pressure on our nerves. And so we're able to break up some of those fascial adhesions, get the body to position. So like here, you can already see our patient's scapula is moving much better and it's higher up. Whereas when we first started, it was farther over this way. And when it's going this way, it's pulling on all this tissue, which is causing pain up here. And so that's one way that it can help with that. And then also too, the tissue that we are affecting as well at the cellular level is we're helping it for regrowth in that area as well with the growth factor activation and microcirculation activation as well. So sometimes when we're treating, I know that it feels like we need to treat that specific area, but it might not necessarily be the area that's causing the pain. It might be a symptom of the actual cause.